An unvaccinated 2-year-old boy was taken to Kenya. When he returned to the United States, he had contracted the measles. Before being diagnosed, he started to develop a fever, cough, and vomiting. He passed the virus on to 3 children in his child care center and 1 adult at home. Before he was even diagnosed with the measles, it was spread and infected to more than 3,000 people. Most of the children that were infected were old enough to have the measles, mumps, rubella, also known as MMR, vaccination, but their parents had decided not to have it done. This study and research is done by Norton of an outbreak of the measles in Michigan in 2014. Children are very vulnerable, and it affects everyone in our community and everyone's lives. If more and more children are voluntarily not being given the vaccinations, it's important to understand that they need to have them. These diseases and illnesses are completely preventable, and they can spread and infect our children. It's important to know the benefits and the effects of not having their children vaccinated. As parents become more and more accustomed to denying vaccinations in the United States for their children, they're negatively affecting their children's health and wellness. It's important to take advantage of the improvement and the improvement of vaccinations in the United States and to have them vaccinated and done in the correct time frame. Let's take a look at the history and improvement of vaccinations, the risks and the benefits of having your child vaccinated. Let's begin with the history and improvements of vaccinations. Vaccinations have come a long way since they were first introduced into the United States. Between 1802 and 1806, vaccinations made its way to the United States. In 1802, vaccinations were endorsed. Massachusetts became the first U.S. state to encourage the use of vaccinations against smallpox. Dr. Waterhouse was the first doctor in Boston who obtained vaccination materials and convinced the Boston's Board of Health Education to sponsor public tests of vaccinations. 19 volunteers were successfully vaccinated, and that came from the College of Physicians of Philadelphia in 2016. In 1803, the origin of the term vaccination was created, and it came from the Latin word vacca, which means cow. In 1806, the U.S. President Thomas Jefferson stood by vaccinations and became an advocate of it, receiving a copy of Edward Jenner's work, who had originally come up with the term vaccination. In 1855, the first United States vaccination law was passed. In Massachusetts, this law was passed that required school-aged children to be given the polio vaccination. This law forced all parents to have their children vaccinated that were sending them to school. If they did not, they were not allowed in school. This allowed more children to be protected from a preventable disease, and mortality rates among children in the United States severely decreased. This came from the College of Physicians of Philadelphia, written in 2016. On March 1st, 1947, a massive vaccination effort occurred in New York City. A man named Eugene Labar, merchant, traveled from Mexico City and arrived in New York City with his wife. He began to feel ill. He had a fever and cough. He was having the chills. He was later transported to the hospital of the contagious disease. He died 2 days later. Labar's death was not immediately attributed to smallpox, yet after 2 other individuals in that same hospital started to have noticing the exact same issues with fever, cough, and vomiting, the staff notified the health department immediately. That launched a massive smallpox vaccination program in the city. The health department attempted to trace all of his previous steps and everyone who he became in contact with before entering the hospital. The health commissioner visited the New York mayor and asked for $500,000 to purchase additional vaccinations and to hire additional staff. They were able to get the money and the additional vaccinations done. This resulted in a mission to get everyone vaccinated for the smallpox. He held a press conference and had everyone over the next month, which is 80% of the city residents, who were vaccinated. That was 6.35 million people. In the end, the vaccination effort was considered a success. It only reached 12 people of the population in New York City, and only 2 people died. One of them was Labar. This came from the College of Physicians of Philadelphia in 2016. Before the incident, hundreds of people in the United States were dying from smallpox. This saved thousands of people from dying, like from the past, from other smallpox outbreaks. It allows vaccinations to become an important aspect of health and wellness in the United States. From this point on, New York City continued to have a success with vaccinations. The process continued in a positive way as well. Many other vaccines came about and started to become tested on chimpanzees. Once that was deemed successful, it then moved on to volunteer humans. Today, there are many vaccines available in the United States that prevent and protect our children from preventable diseases. The most important ages to have this done is birth to 15 months and in the correct order. These include hepatitis B, rotavirus, diphtheria, tetanus, Xelera pertussis, hemophilia influenza, pneumococcal, inactivated poliovirus, measles, mumps, rubella, varicella, and hepatitis A. Now let's take a look at the risks of not having your child vaccinated. There are many risks and issues involved with not having them vaccinated. Influenza, also known as the flu, kills hundreds of children every year from not having their vaccinations done. Pertussis, or also known as the whooping cough, is extremely dangerous for babies, especially those that aren't old enough to have the vaccinations. This can result in permanent damage of the brain and death. Measles is a highly contagious disease that can lead to serious complications, including death. The disease remains still very common in the United States and is brought back to the United States by other returning visitors. The children and teens who are not vaccinated are unprotected from measles. This has led to outbreaks of measles in the United States due to parents not having their children vaccinated. Chickenpox is also a very contagious disease that people from every year could be potentially dying from. Children who are not vaccinated can transmit vaccine-preventable diseases at school and in the community. Unvaccinated children can affect babies who are too young to be vaccinated, and this is very dangerous for their brain and can lead to death. Unvaccinated children can affect people of any age, especially those that their immune system are too weak that they cannot get vaccinated. Those include cancers like leukemia or people who are taking medications or treatments that can suppress their immune system. Your child may also be excluded from school or from daycares. This can lead to financial and family issues and can maybe feel like the child is out of place. Let's also take a look at the benefits of vaccinations. Vaccinations have many health benefits. Having an immunization can save your child's life. It can protect them against many other diseases than ever before. Many diseases that used to wipe out thousands of people have completely been eliminated due to vaccinations. Polio is the best example. In the United States, people feared that disease of polio because it caused death and paralysis. Now, because of the vaccination, there are no reports of polio in the United States. Vaccinations are very safe and effective. They are only given after extensive research and long, careful reviews by scientists and healthcare professionals before they are administered to the correct age of a child. Although they do involve some discomfort and pain at the very inside of it, and redness and tenderness, it's very minimal compared to the amount of pain and trauma of the disease that is being prevented by this immunization. It can protect yourself and others around you. Children in the United States still get vaccine-preventable diseases. There have been several hundreds of whooping cough and measles, also known as the pertussis, over the past year. Since 2010, more and more parents are denying vaccinations for their children, and between 10 and 50,000 cases of whooping cough are aware each year in the United States, which lead to 10 to 20 babies dying every year who could have been fully vaccinated. While some babies are too young to be protected, it's important to have the other children that are around them to have that preventable disease vaccination. Immunizations also protect for future generations. Vaccinations can reduce and eliminate many diseases that in the past have killed or severely disabled people. One example is rubella. This also helps with the risk of pregnant women who will pass along the virus to their fetus. It has dramatically decreased that when this passing along happens, the vaccination is actually preventing it. If we as parents continue to vaccinate now and incomplete in the future, some diseases of today will no longer exist in the future if we continue to vaccinate our children. Getting children vaccinated or not directly affects our entire health in the United States. For those of you as parents who do not feel that a vaccination is necessary for your child, remember it is important to be proactive. Go and seek healthcare professionals and seek advice. If you are as a parent, I'm sure you have younger siblings. If you're not a parent, I'm sure you have younger siblings, nephews, nieces, friends with children. It is important to be aware of your surroundings and let them know if they do not feel that they need to vaccinate their child. Remember what I said today in this speech of why it's important to have that done. It's also important to be proactive and take your children to have the proper age checkups and have them vaccinated. Vaccines over the past 2 decades have prevented 3.22 million illnesses, 21 million hospitalizations, and 732,000 deaths over their lifetime, according to a new report from the Center of Disease Control and Prevention. Imagine if your child contracted a preventable disease and became paralyzed or died from something that as a parent that you could have prevented.